Okay, open enrollment 2026 is almost here. This is going to be the most disruptive enrollment season in recent years for agents and for consumers alike. So agents, if you don't adapt, you're going to fall behind fast. So the automatic re-enrollment rules are changing, subsidies are shifting, benefit plan designs are being reshaped, stricter verification processes are coming for clients in terms of verifying income. So these updates are going to directly affect, obviously, how clients qualify for subsidies, what they pay, and the guidance that they would need from agents and brokers. So you don't want to ignore these updates, these changes, especially have to pay attention now. We don't want clients to lose their subsidies, get stuck in the wrong plan, or get dropped from coverage altogether. That means lost trust, obviously, lost revenue, and lower client retention and missed opportunities. So that kind of goes without saying. Now, let's just touch on some of the key highlights here, things that are changing into the 2026 open enrollment, right? So, all right. So the big four areas of change, updates to the automatic re-enrollment process, right? Number one, the changes in the subsidy levels, the benefit design changes, and obviously the additional verification processes. So one of the bigger changes, like in the past, for folks that were in a bronze plan, and if there was a CSR silver level plan, so folks that qualified for cost sharing reduction on those silver plans, if there was an equivalent in terms of network and cost to the bronze plan they had, they'd move folks over to a silver plan, which had much lower out of pocket exposure. So that's no longer going to be the case for 2026. So you want to pay attention to those folks on the bronze plans and make sure that they're still in the best plan for their situation. If there's a comparable silver available in terms of network and cost, obviously, most likely they'd want to move into that plan. So you have to be a little more proactive in reviewing those clients that could be eligible for CSRs that are in bronze plans. Okay. The next big one is the subsidy level changes, right? So this before there used to be what they call the cliff, right? This cliff. So an easy example would be if you had, let's say, husband and wife, they're around 60 years old, they could make, like, let's call it $67,800. This was from a few years back, could qualify for a pretty significant subsidy. So maybe $1,000 a month. But then if they made just $1 over that cutoff, then they'd be paying full cost. So they used to call that this cliff, which the prior administration did do away with, right? Where it was more of a gradual drop as your income got higher and higher. So that is set to come back unless these enhanced subsidies are extended. Now, there's no clear indication of whether that's going to happen. This could go into December before there's really a final decision on that. And obviously, that is right in the middle of the open enrollment. So something to definitely pay attention to. We have to prepare clients for either scenario, right? So this is what those original ACA levels, premium contribution percentage, that percentage is based off income, that it would cost somebody in these FPL brackets, right? So that the repayment cap too, there used to be a cap on subsidy repayment based on your income. So for example, you could have said that you were going to file married filing jointly, right? And one spouse makes 25,000, one spouse makes 100,000. Well, if you ended up filing separately or, getting divorced, but let's use filing separately as the example, the repayment for that individual that made less than 25,000 was like around $300. That was the most they were going to have to repay. And that's gone. So that's not going to happen. They'll have to repay the whole subsidy amount, right? So that's a big change on that cap. So, and obviously every year we have some benefit design changes. So number one, your deductible out-of-pocket max is gonna go up. It goes up slightly. This year it's another $250 for an individual, $500 for a family. That's going to be another change. A good change here is like bronze plans. So all the bronze plans are going to be treated as HDAPs, high deductible health plans. And why that is significant is because those plans now qualify as HSA compatible plans. So folks that have a bronze plan, they may have a doctor copay of $50. They can contribute to an HSA, use those HSA dollars for out-of-pocket medical expenses the same way they could before with HSA qualified plans. Now, prior years, HSA qualified plans were plans that you had to pay towards a deductible for all services except preventative. So that is a pretty significant change. Okay. So that's, a big opportunity for some extra tax savings for those folks that are in those bronze plans. Okay. So here's another big change. The DACA recipients are no longer eligible for subsidies because they no longer qualify as being lawfully present in the United States. So that's a change that's coming this year, along with some other verification changes that we'll get into here. So the enhanced income verification requirements. Okay, so these are, you have to prove income, right? And it's based on what your current income is at that time. So if whatever you're putting into the marketplace, you should have to show some proof of income that is directly correlated to that amount, right? Whereas in years past, people were kind of using, hey, this is what I made last year. I think this is what I'm going to make, even though my current income per month may be different and it fluctuates. So again, these are some acceptable forms of documentation, which is not a big change from years past. It's just people have to be a little bit more specific, and this verification for income documentation is just going to come up more frequently, right? Especially if there's a 20% change from what you reported year over year. So last year, if you thought you were going to make 60,000, and then you had more of a 20% change for what you expected to make this year, which would equate to 12,000 or more, you're going to have to show income, proof of income. Okay. So again, pay stubs, they have a written explanation form. Okay. And then also for folks that haven't filed a tax return in prior years and reconciled prior subsidies, you're not going to be able to get a subsidy going forward until that's resolved. Whereas in the past, there used to be an attestation box that you could check to still get the subsidy applied going forward. So there's going to be more personal responsibility here for clients and documenting and verifying the proof and their income estimate going forward. So if you're an agent, obviously you want to prepare clients, make sure they're in the best situation possible. You have to review those folks that are on the bronze plans that could be eligible for CSRs, right? You want to make sure that's clear to them. The folks that benefited from those enhanced subsidies, that's going to be a big change this coming year, especially if that is not extended forward. So, what we're going to be doing is obviously scheduling reviews for all these folks, introducing the new HSA eligible bronze plans and what that means to them, how they could benefit, ways to set up a health savings account, just being, proactive. Income documentation is a big thing. So getting that communication out, what that's going to look like going forward. I know sometimes it can be a lot for consumers. It's not something that they do, obviously, for a living. It's not something they always pay attention to. So it's kind of on us as agents to kind of get that word out there to them. So it's going to be probably the most disruptive open enrollment from what I can remember, since it really started, right, in 2014, and then even 2020, through COVID, it was pretty disruptive. So it's going to be a significant change this year, but getting the word out to your consumers, reaching out is the best way to be prepared. Just making sure you're staying up to date on industry changes. If you like this video, we have another one that's kind of similar to this on this topic right here as well that you can listen to, and you can also subscribe and continue to follow us.